Hello, everyone. My name is Raymond Sarmiento. I'm one of the registered nurses here, and welcome to Wesleyan University Hospital. Today, we'll do a patient experience orientation. To start with the orientation, let's play the video. All right. In the next 20 minutes, you will be able to understand the patient experience impact both for patient and health system, differentiate patient experience from patient satisfaction, apply the evidence-based strategies to improve patient experience, and develop a strong commitment to provide a positive experience for patients and families. All right, before we define patient experience, what can you say about the video? Okay, very good. It's about empathy. What else? It's about compassion. Perfect. What else? Okay, it's about a holistic care. Yeah. All right. From the video alone, it's tell us that to employ empathy whenever we see people in the hospital because we don't know uh, we are facing their own they are facing their own battle. So be careful how to talk to them, how to deal with them, and how to answer their questions, especially if they're asking some few questions and some frustrations if they show frustration. So that's fine. All right, let's define patient experience. It is an approach to healthcare that places the patient needs, preference, and values at the center of care. It includes every interaction with a healthcare provider. This interaction occurs before, during, and after patient visits. It's the sum of all interactions shaped by an organizational culture that influence patient perception across the healthcare. All right, patient experience include but not limited to patient's provider website, ease of parking, facility and room temperature, cleanliness, staff friendliness, accessing billing statement or health record electronically, ease in scheduling appointment, and satisfaction with interaction between physicians and other member of the healthcare team. Communication effectiveness when discussing treatment options, understanding out-of-pocket financial costs related to treatment or medications, the overall quality of services rendered during the visits, and timeliness during the service delivery, such as a doctor appointment, wait times, and test results. So this is the overall aspect of patient experience from culturally approach care, care coordination, courtesy and respect, getting information, shared decision making, self-management support. Okay, let's talk about patient experience versus patient satisfaction. Sometimes patient satisfaction and patient experience is they're telling it's the same, but there are difference with it. From the definition alone, patient experience is the total sum interaction, perceptions, and feelings throughout the healthcare journey, while patient satisfaction is the extent to which patient reach or meet the expectations are being fulfilled. So in short, it's patient satisfaction is we're setting an expectation if we're going to meet, while patient experience is how they feel or how they were treated during the hospitalization. All right. What are the benefits of patient experience? First is improved patient satisfaction and better patient outcome. Of course, if we're doing if they have a good patient experience during their hospitalization, so definitely it will improve their patient satisfaction and they will be more happy. And a better patient outcomes means they will be more compliant with their treatment, with their follow-ups, and with the discharge instruction. Second is increased revenue. Okay, patient satisfaction will affect the revenue of the hospital if we have a good patient experience. So one family or one patient will tell to their friends, family members that, oh, this hospital is very good. They treated me well. So I will recommend this hospital. So it means more loyalty and more clients. Third is improved reputation. Here in United States, they are ranking hospital as best hospital. So that is based on patient satisfaction and patient experience. So if they have a better patient experience, they will have a best or good patient satisfaction survey. Thus, they will rank as one of the best hospital. So it means it will increase the reputation of the hospital. The next one is increased staff satisfaction. So with the patient experience, we're ensuring that the patient is safe as well as our staff. So it will decrease workplace violence. It will improve communications among our staff and the patient. So it will increase staff satisfaction. The fifth one is greater adherence to patient treatment plans, as what I discussed a while ago, and fewer lawsuits. All right. Are you wondering how patient experience is being measured? So there are four ways to measure patient experience. First is patient satisfaction survey. So if we have a better experience or a good patient experience during the hospitalization, it will reflect on the patient satisfaction survey. The next one will be the patient experience report. They're given the patient a report or a survey where they will put a narrative how they feel or how they were treated during their hospitalization. And for third is patient complaint. If we have a good patient experience during the hospitalization, it will decreases our patient complaints. So if there's a low patient complaint, it's tantamount to good patient experience. And fourth is focus group. According to studies, there are different strategies to improve patient experience. First is enhancing communication, wherein that's the strategies that we're going to focus in this training or in this orientation. Second is empathy and emotional support. Of course, we always ensure that we are offering empathy, not sympathy, to our patients and family member. Number three is care coordination. Fourth is physical environment and amenities. So make sure that our environment is clean, that our amenities are appropriate to the patient conditions, and as well as the family. And the last one is patient education and engagement. Of course, we need to educate our patient so we will have a better experience as well as patient outcome and compliance to the patient and family members.
Guys, it's almost 5:30. We've been here 3 hours. Are you okay?
No,
Are you
I'm
feeling-
not.
Hi, how you doing?
Are you my doctor?
Yeah, I'm your doctor. You're his wife?
No, I'm his sister.
Okay, all right. So what's wrong?
What's wrong is that I've been sitting here for about 3 hours.
Yeah.
Okay. Well, yeah, I know it seems like a long time. You know, I will have to say it's an emergency department, and 3 hours isn't too bad in an emergency department. But you know, so what brought you in?
Well, the last couple of days I've been having this coughing and
Okay.
a bit feverish.
Okay, all right. Well, we'll have to check that out. So let me examine you. Okay. Yeah.
There's Dr. Jones on line one.
Okay, so Dr. Jones, if he sends another patient that should have came in 3 days ago on respiratory stress, I just tell him to just take a second. Okay, hold on. Okay, so let me examine you. Let me have you sit up. I'm gonna listen to your lungs now. Okay, listen to your lungs. Okay, yeah. So don't cough when I'm listening to you, so I can listen to your lungs. And if you guys mind just being quiet for a second, go ahead and take a deep breath. Okay. Huh. Huh. Okay, you know what? Yeah, you're gonna need an X-ray.
Ugh,
So I'm gonna get you that X-ray. I'll order that X-ray. Okay?
how much time is that gonna take?
Don't worry about it. It won't be that long. I'm gonna order an X-ray. I'm gonna go order it right now. You know, they're a bit busy, but it shouldn't be
I've
that
been here all
bad.
day.
I know. Well, you really still think you need the X-ray, so let's get the X-ray, find out what's going on. Okay? All right, man.
Call Mom, will you? Let her know.
Yeah. Don't listen. Don't worry. Just stay calm, and they'll be back eventually.
Okay, what could they've done better? Okay, good. So you said it's poor communication. Okay, what else? Okay, not in a hurry. They should not be in a hurry. Okay, okay, they must be more compassionate. All right, so the way how they treat the patient is like it's they're giving a poor or they're using poor communication effort to ensure that the patient is having that the patient will have a better experience. As what I've said a while ago, so we will focus on effective communication strategies for this training. So this includes how to use AIDED and what is AIDED. Second is purposeful area rounding. Third is the use of communication board. Fourth is bedside shift report. And fifth is leadership rounds. Okay, what is AIDET? AIDET is a communication framework for health professionals to communicate with patient and each other in the way that decreases patient anxiety, increases patient compliance, and improve clinical outcomes. AIDET stands for A for acknowledge, I for introduce, D for duration, E for explanation, and T for thank you. Okay, what are the benefits of using AIDET? First is improve patient and customer perception of care services, decrease anxiety for both staff and patient, build patient and customer loyalty, increases a compliance resulting in a better clinical outcome, and ensure a service provider deliver consistent measures of empathy, concern, and appreciation. Okay, here's the step of AIDET. A, when you're acknowledging the patient or acknowledge anyone inside the room by simply greeting them and using a smile, so you're doing already the acknowledge. I is to introduce yourself, who are you, and how are you related to your patient. And D is the duration of what you're going to do, and E is to explain what are you going to do and always say thank you at the end as a courtesy to your patient. All right, let's watch this video clip. It's an example on how to use AIDET.
Hi, Mr. Smith. How are you today?
I'm okay. Just call me Philip.
Nice to meet you, Philip. My name's Matt. I'm from the respiratory department. I'll be the respiratory therapist taking care of you tonight.
Oh, okay.
So we'll be doing a breathing treatment tonight. It'll take about 10 minutes.
10 minutes. Whatever. I'm here all night anyway, so.
Perfect, me too. So this breathing treatment will help open up your airways and make it easier for you to breathe. I'm just gonna need you to put this in your mouth and breathe in and out normally for 10 minutes.
How am I doing, all right?
Good. How do you feel after that treatment?
I'm feeling okay, thanks.
Is there anything else I can do for you tonight, Philip?
I don't think so. But thanks for explaining everything anyway.
Of course. Thank you for letting me take care of you tonight. I'll be here all night if you need anything.
Okay.
All right. Good night, Philip.
Good night, Matt.
All right, the next step or the next strategy for improving or enhancing effective communication is the use of communication board or the whiteboard inside the patient room. It's our writable whiteboards placed inside the patient care rooms besides every patient bedside. The purpose of this one is to support our communication between patients and their families and the medical care team during their stay. So the picture is one of the example wherein you need to update it every day or every shift during what are their goals, what are the important details in the things that you need for the communication. All right, here are the top 8 dose when making or using patient communication board. First is make it readable. Of course, you want them to understand your handwriting, so it should be legible. Number 2 is design to be updated. So you must update it every shift. So you must know what are your goal during your shift, what is your patient goal during shift, and then what are the things that they need to remember. Let's say, for example, they need to be NPO during or at midnight because they have a procedure tomorrow or in the next day. So that would be the best reminder for them. 3 is attach the pen to the board. Yeah, because sometimes family wants to write something that they want to give to the nurse or to the doctor. At least they can write on the board. Fourth is tackle the appropriate appointment list. Fifth is include early rounding tracking. Some hospital they have in the whiteboard the tracking boxes or the a little box in the lower part to track their early rounding. Six is to check during nurse leader rounds. So the nurse leader will check the one during the rounds as well as they will put some notes to enhance or to show empathy to the patient. Seven is independently assess the effectiveness, and eight is to update the board early morning or every shift. All right, the next strategy will be purposeful early rounding. It's not just only rounding, it should be purposeful and it should be early. So it's a systematic, proactive, and nurse-driven evidence-based intervention that help us anticipate and address patient needs. According to studies, there are benefits of purposive early rounding or purposely early rounding, wherein they found out that there is a 20% reduction to distance walk each day by nurses, a 12% increase in patient satisfaction score, 52% reduction in patient fall, 37% reduction of use of colight, and 14% decline in skin breakdown. Of course, when you are doing the outer rounding, will reduce the colight because you will address the different things that the patient needs and patient wants, especially like food or going to the bathroom or the toilet, and reposition them to prevent pressure injury. When doing the early rounding, we need to check for the 5 P's. First P is pain. So always ask the patient if they have pain or they need some pain medication to make them more comfortable. Second is potty. Do they need to go to the toilet to do the potty, or they need to do number two? So we need to address the one. Number three is positioning. Make sure that they're comfortable. Ask them if they're comfortable or if the patient is unable to communicate, then in bed bound. So we need to reposition them to prevent pressure injury. Number four is possessions. Make sure that they have their call light near to them, their personal belongings, or the things that they need, like their water, or their purse, or their bag, their comb, their wallets, or their cell phone. And then C is the personal needs. So just ask them if they need something, like if they're hungry, or they need some water, or they need something to make them more comfortable. The next strategy will be the purposeful leaders rounding. So a member of the hospital leadership will do the rounds or make a rounds to interact with patients and families or the caregiver itself. This helps leaders to directly understand patient experience, identify potential areas for improvement, and make decisions. During the leaders round, it is the best time for them to recognize or reward any one of the caregivers or the staff who are doing well. It's the best time for them to harvest the hard earned patient safety experience that the nurses are giving. Second is behavior. Display empathy and active listening. Sometimes they have a lot of things that's happening to their life and they need someone to talk to. Three is visibility. So leadership should have a visibility among the patient and staff nurses, because during the HCAP surveys or the patient satisfaction surveys, they're asking if the leaders are doing their rounds. Then fourth is frequency. So round at the consistent intervals. So ideally, leaders round must be done every day. And then lastly is feedback. It's the best time for them to ask feedback for the hospital services, for the experience that they have, or any suggestions that they can give to improve patient experience as well as hospital services. All right, what are the benefits of a purposeful leaders rounding? So first is improve staff engagement. Of course, it will address what they need, not only the patient, it should be, as well as the staff. Nurse is retain staff if they are happy and they have a good staff engagement. So there's a chance that they will retain or keep their current job. Third is improve outcomes. So of course, if we have a good experience or patient experience, it will increase also our patient outcome or improve our patient outcomes in terms of our key performance indicator. Next is increase quality, create action plan, elevate patient experience, and enhance communication. All right, the last strategy would be the bedside shift report. Bedside shift report is a change of shift report between outgoing nurse and the incoming nurse that takes place at the bedside, not at the nurse station, not in the hallway, not in the bed, in the door. So, report help ensure the safe handoff of care between nurses by involving patient and family. What are the purposes of bedside shift report? First is to engage the patient and family in the hospital care. Second is to share accurate and useful information between nurses, patients, and families. What are the benefits of bedside shift report? First is acknowledge patient as their partner. If they feel that they are part of the treatment, they will be more compliant. Second is encourage patient and family engagement. Third is build trust in care process. Fourth is better information about the patient condition, accountability, time management, and patient safety. So patient safety, this is the best time for you to check for your patient if they are safe at the start of your shift, like checking if the bed alarms is on or the call light is within reach, and tell them that use the call light whenever they need some help, and update the communication board and to answer some questions or their queries, or if they have some pain, or you can see if they have a respiratory or our patient are in distress this time. Studies suggest that using the SBAR technique is one of the best way to give a bedside sleep report. SBAR means is S for situation, B is the background, A for assessment, and R for recommendation. There are critical elements of bedside shift report they are suggesting. First is introduce nursing staff, patient, and family. Second is invite the patient and family member to participate. Third is open medical or electronic workstation in the patient room, but be careful with HIPAA or the sensitive information that someone can see behind your computers. Fourth is conduct a verbal SBAR report in the patient and family using word that they can understand. So don't use medical terminologies. Use only the layman's terms so the family and the patient can understand. Remember, they are not medically inclined or they don't know medical terms. Fifth is to conduct focus assessment of patients and safety assessment of the room. Six is to review tasks that needs to be done. And seven is to identify needs and concerns of the patients and the family.
Hi. Hello, Mr. Brown. I'm
Hi.
Dr. Finnifer.
How are you? Are you my doctor?
Yeah, I'm going to be your doctor today. What's
Great.
your relation to me?
Hi, I'm a sister.
Hi, nice to meet you.
Nice
Hey,
to meet
I'm
you.
sorry about your wait. I saw you've been waiting a long time, and I really wish that wasn't the case. The good thing is that the nurse actually already ordered an x-ray for you, and I think it's going to be very appropriate in your case. But are you comfortable?
Yeah, I don't feel so hot, but other than that, I'm fine.
Okay, well, just to let you know, if we need to adjust the stretcher here, the lever right here goes
Okay.
back and forth, so
All
we
right.
can use that if need
Okay,
be.
thank you.
Okay, Mr. Brown, how can I help you today?
Well, I'm here because for the last couple of days I've been coughing and I've been running a fever
Okay.
and just feeling weak.
Yeah, I actually haven't seen him this bad before.
Kind of worn out, huh?
Yeah.
Okay.
Yeah.
Okay, well, I'll tell you what, let's examine you and see if we can figure out what's going on, okay?
Dr. Finnifer?
Yeah,
Dr. Jones on line 1.
Dr. Jones. Okay, you know what, tell Dr. Jones I'm with a really important patient. I'll get back to him in a second after we're done here, okay? All right, thank you. Okay, sir, let's have you sit up here. Listen to your lungs now. Examine you. I'm ready. Just take a little break. And give you another breath. Okay, all right, let's have you sit back. So I tell you what, I do hear something in the lower portion of your right lung. And in my experience seeing almost thousands of patients, I think, with pneumonia, I really think you do have pneumonia. So I'm glad we were getting this x-ray. I think we'll need to get that to confirm and
It'll be
see
a
the
long
extent
time?
of it. You know what? It's we're pretty busy. It will take about an hour. I'm gonna
Yeah.
call them and tell them, to expedite it. We're gonna
That's
definitely
fine.
do our best. I do think that even with that, I think it's important because I think this will be able to tell us if it's pneumonia, and if it's pneumonia, maybe it's just in that one spot in the lower lung, and if that's the case, then then I think it'll be something easily treatable. So
Okay.
but I'll let you know as soon as I see the X-ray.
Okay.
Anything
Alright.
else I can do for you while you're here?
Are you-
I'm starving. We've been here for hours.
Oh, okay. I'm sorry.
Is there
You
food
know what?
around here?
Yeah, absolutely. We'll get you something to eat.
Okay. Thank you. I appreciate it.
Okay.
Okay, no
great.
problem.
Okay.
Alrighty, thanks.
Thank you, Doc.
Thank
No
you,
problem.
doctor. Thank you, doctor.
All right, from the video that you've watched, what can you say about it? Perfect. The use aided. What else? Very good. The doctor is not in a hurry. If you see the doctor sit at the bedside just to talk to the patient, it means that the patient or the doctor is not in a hurry. What else? Okay, interruptions. So less interruption and more appropriate way of communication. What else? Comfort. Yeah, very good. Overall, what do you say? They have a better or good experience or low patient experience. So definitely they will have a better experience. All right, that's the end of my presentation. And anyone who's having a question, this is the best time for you to raise it. All right, if no more question, thank you for choosing Wesleyan University Hospital, and we will proceed with the activity. So we'll have a role play. I'll group you into three. One will be a patient, one will be a nurse, and one will be a incoming nurse for incoming nurse. And then the scenario will be you will do a bedside shift report using aided bedside shift report, whiteboard communication, and the SBAR technique. All right, so I'll give you some few minutes to discuss with your script, and then we'll come back for the presentation. Thank you.